Hi everyone, and welcome to another session of Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health, internal medicine physician at Exchange Place. And here today with me is my co-host, Dr. Akunyili.
Welcome everyone. I'm Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of RWJBarnabas Health. I'm also an emergency physician. I'm very excited to be here today.
Yeah, today we're going to have a very special guest, which is really right up my alley because you know how much I love cardiology.
Yes.
And we're going to have Dr. Deepak Singh actually come and join us. So,
Dr. Singh is just unbelievable. He is that person you want in a cardiac emergency. He's new to a system and very dedicated to all kinds of cardiac care and, to access for this community. And he's really going to talk to us about advances, even in things like bypass surgery that have been around for a while. But something that's very exciting is he's going to talk about procedures that maybe people did not know were available 10, 15 years ago in relation to repairing the aortic valve, etc. So he's going to talk about that. He also has a special passion for heart failure, so can't wait to hear everything he has to say.
My understanding is he's brought some models and some toys that he's going to play with and show us.
Looking forward to seeing all of that.
And again, being because he's a cardiothoracic surgeon actually, so what we're going to do is we're going to go take a break, and we'll be right back.
Okay.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you, so get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of RWJBarnabas Health. I have with me today my co-host, Dr. Angel Lazo.
Hi, my name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. So we're going to be speaking to Dr. Deepak Singh.
So Dr. Singh is a cardiothoracic surgeon. So we're going to start by asking him, not everybody knows what a cardiothoracic surgeon does. So we're going to ask him about, what do you do? And
I mean, I get asked that of my patients, are they cardiologists, are they surgeons? So again, he's going to break it down for us. One of the beautiful things about Dr. Singh is his demeanor. You can still get his passion, but you can see how soft-spoken he is, how he's used to actually dealing with high-stress situations. Very soothing, especially for a cardiologist and a surgeon. Very impressive.
Somebody's going to do surgery on your beating heart, it would be him. We're going to talk about procedures that he does, just common procedures that we have available here at Jersey City, because he really brings the best in class to us. We're going to talk about the TAVR, the transaortic valve replacement, and bypass. I hear he does have some show and tell for us.
Correct, yeah. And again, he's going to cover the whole gamut for us because, again, cardiovascular disease is a leading cause of death worldwide. And again, he's going to break it down for us, what it means, what exactly is cardiovascular disease, is it disease of the arteries, is it disease of the muscle, the valves, et cetera, et cetera. He's going to cover that whole gamut for us.
So as our life expectancy gets longer, which is a good thing, then, there is wear and tear. It's kind of like a car. You get mechanical wear and tear. So there are all kinds of advances to keep people who are living longer to have more healthy, functional lives at any age. So I'm really excited about that and all the thoughts he has about having our community have access to those resources and procedures.
In cardiology, especially, the technology continues to advance, so you have these very minimally non-invasive procedures, with some incredible outcomes. I mean, think about it. We're going to be having a cardiothoracic surgeon that's actually going to be talking about TAVRs, because this used to be their bread and butter.
Well, right. They used to have to do open heart surgery to replace your valve if it's weak or diseased. But now it's done through a catheter and a little incision. Like, this is leaps and bounds from even when I trained.
Yeah, absolutely. And especially the importance of catching a lot of these diseases early, you know, especially, for example, with the TAVR programs, it has to have a significant impact. I mean, in the old days, we basically waited, you know, up and until a specific timing, let's say for aortic valves, before the patient developed heart failure to try to time the valve replacement. And I can tell you, honestly, in my practice, you know, aortic valve replacements were a nightmare. I mean, irrespective of whatever type of valve they got, you know, the recuperation process from aortic valve stenosis is different than just about every other valve.
I agree, but you know, everything we talk about is just as good as getting access to our population. We keep harping on that, and he's going to talk about the interdisciplinary team that he has with cardiology and making sure you're getting to them, or even to the emergency department if you're having chest pain, weakness, shortness of breath. He's going to talk about some of the more dangerous, scarier cardiothoracic emergencies that could really masquerade as chest pain. So we're going to talk about all that with him. Very excited he's going to join us.
And again, it's not just the heart. You know, they deal with the lungs, vascular, they deal with cancer in the chest, you know, esophageal cancer, for example. I mean, I believe Dr. Singh specializes specifically in open heart surgery and in the heart as an organ.
Yes.
But his expertise is just incredible. And we're able to offer this comprehensive cardiac care. We're the only ones in Hudson County that offer the full gamut as far as cardiac care. And again, he's even going to talk to us about some of the advances in heart failure. And what do you do, for example, if you have advanced heart failure and your heart's failing? And in the old days, I mean, this was actually heart transplant material. But it's changed. You know, the evolution in the technology, especially in cardiology, has changed so that they don't have to necessarily qualify necessarily for transplants anymore. There's other modalities that you can actually do, which he's going to go over with us.
And that's a game changer that for so many people in our population. So why don't we go ahead and bring in Dr. Singh?
Sounds like a great idea. So let's take a quick break and we'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Welcome back. I'm Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And I have the spectacular honor to introduce our Chief of Cardiothoracic Surgeon, Dr. Deepak Singh.
Well, thank you very much for those kind words. My name is Deepak Singh. I'm one of the cardiothoracic surgeons for the system, and in particular, I'm the Chief of Cardiothoracic Surgery for Jersey City Medical Center. It's a great honor to be here with you guys. Just a little bit about myself. I grew up in New Jersey. I went to an accelerated MD program, and then I did my training out in Pittsburgh with specialty in heart failure and mechanical assist devices. I was practicing in Northeast Pennsylvania as the Chief of Cardiac Surgery for Geisinger Health System, and now I'm very excited to be able to bring that specialty to the Jersey City area.
Excellent. So again, as part of the cardiac line, what exactly is a cardiothoracic surgeon?
Oh, that's a great question. So cardiothoracic surgery basically entails any surgery inside the chest, whether it be the heart, the lungs, or the esophagus. And in my focus in particular is that of the heart. And we could deal with a wide aspect of ranges, bypass surgery, valve surgery. We can deal with diseases of the heart muscle itself. And also on the other end of the spectrum, we deal with cancers of the esophagus, cancers of the lung. So we really deal with everything inside the chest.
So I'm an ER doc, an emergency physician. Tell me more about what procedures and what would you tell people at home are the procedures or surgeries that a cardiothoracic surgeon, typical cardiothoracic surgeon would do?
Sure. So heart disease in general creates a huge burden across the country. Approximately 20% of all deaths every year is related to heart disease. And the number one heart disease is coronary artery disease. And that's where you have blockages of the heart. And you may have heard of someone having a heart attack. So there's three main arteries that bring blood to the heart, and it could be a blockage of any one or all three. And there's a variety of ways that it could be treated. What I'm really excited about at Jersey City is that we have a heart team approach. So for every patient, it's their treatment modality is tailored to them. And one of the things that we offer is bypass surgery, and we can do it in a beating heart manner. We can do it a minimally invasive approach. But the great thing about bypass surgery is that when you have very complex disease, bypass surgery helps you live longer. It helps you live longer with a better quality of life in that you don't have to keep coming back to the hospital due to your heart.
All the disease is not necessarily due to, obstruction of the coronary arteries.
Sure.
You do have structural heart disease, valvular heart disease, because you do have a comprehensive program,
Right.
Explain to us, for example, because you have a heart attack and you get bypass,
right.
But now maybe you're dealing with pump failure, you're dealing with valve issues. Talk to us a little bit about that.
So there's four valves in the heart, and you can have leakiness or tightness of any one of them. And historically, the only way to deal with them was with open operation. And we still do that in certain situations, but now we're also excited to be able to offer what we call TAVR, or a structural heart approach to fixing valves, particularly the aortic valve and the mitral valve. So if 10 years ago I told you I can replace your aortic valve while you're talking to me and you can go home the next day, you would think I'm crazy, but that's what we do on a routine basis now. We're able to replace the valve and you're able to go home the next day. So you get all the benefits of the valve being fixed without all the side effects of surgery.
And you've worked with Dr. Skeldon, our Chief of Cardiology.
That's right, yeah. So
we had her in the show.
Yeah.
That's great. Yeah, so Kim and I we sort of grew up medically together, and both learned structural heart together. So that's one of the beauties of our setup here at Jersey City, is that we have a comprehensive center. So you get both cardiology and cardiac surgery working together to achieve the best outcome for the patient.
So something we're both really excited about and passionate about is access to healthcare and health equity.
Yeah.
And when we had your colleague, Dr. Skeldon, we talked about how certain communities have not really access to the full extent, something
Sure.
like TAVR. What would you say, and maybe tell people what the full meaning of TAVR is and the
Yeah.
opportunities that people with aortic disease now
Right.
have to live a full, healthy life?
Oh, sure. So TAVR, or TAVI, stands for transaortic valve replacement or implant. Basically, you're replacing the aortic valve, which is the last valve, and you're able to replace it without a big open operation. And what I would say is that we're a fully comprehensive team. So the important thing is for the valve to get picked up. In other words, your heart disease to get picked up. So what I would recommend is, if you're having any symptoms, is to just contact your primary care doctor, and then they could refer us into our valve center. The valve center is open every day, and appointments are available at all times. And the beauty of it is, when you get seen, you will be able to be seen by both specialties at once. And if any testing needs to be done, it's all coordinated.
And real quick before we go to break, because aortic sclerosis is actually on the rise, which is
Yes.
a little bit counterintuitive with me, because I'm old school, so I'm thinking it's more rheumatologic, but
Right.
Why is it going up?
Well, so, I think, patients are living longer. So if you look at the segment of the population in the U.S., the most rapidly growing is that at 80 and above. So I think valves are being used longer. The people are living longer, not dying of the usual things now. They're dying of old age. And part of that aging process is the valves wearing out. And so we're seeing a greater burden of that. And that's a great tie into the equity portion. Just because you're, say, 90 and you're functional does not mean that we don't have an option for you. In fact, our oldest patient was close to 100. So there's a lot of options out there, but that's one of the reasons you see that on the rise.
Well, we're going to bring you back in just a second after this commercial break, because we definitely have more questions for you. So we'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, facility of RWJBarnabas Health. I have with me today my wonderful co-host, Dr. Angel Lazo.
Hi everyone, my name is Dr. Angel Lazo and I'm with RWJBarnabas Health at Exchange Place. So we're here today with Dr. Singh and coming back for the next segment. So we were talking about bypass surgery. So can you show us, can you illustrate?
Sure, I'm glad you asked me that because that's a question I get often. So this is a typical heart, and what I wanted to show you is that there's 3 arteries, one on the right, one on the front, one on the left. And when we do bypass surgery, one misconception is that we cut out the diseased vessel, but what we don't. We literally create a detour around it. And this is a very typical operation where we take the chest wall artery and we just bypass beyond the blockage. And this is where you get the number, a quadruple bypass or triple bypass. It just depends on the number of bypasses that we do. So that's what a bypass surgery looks. And we can do it with the heart beating or with the heart stop. You can do it both ways. And the great thing is, despite it being around for a while, bypass surgery has been over and over and demonstrated in studies that it helps you live longer and helps you live longer with a better quality of life related to your heart, so you don't have to keep coming back to the hospital.
That's fascinating. Yeah. We could be here forever. But you know, something else I see in the emergency room is aortic aneurysms.
Oh, sure.
You know, that's sort of the big scary emergency. Right. And for people who don't know what that is, that's something you treat. Can you tell us more about it?
Yes, absolutely. I'll go back to my model here.
Perfect.
So the aorta is the big blood vessel that distributes blood to the entire body, and it should be a certain size just based on your how big you are. But it can enlarge, and it can literally enlarge like a balloon. And sometimes you could tear on the inside. That's called a dissection, or it could rupture. Now the counterintuitive thing is that if it ruptures, you have some time still to get to the emergency room. And that's one thing that I'm really excited to bring, is that we're able to bring new techniques to fix dissections or ruptures at Jersey City Medical Center. So that's available 24/7. And there's a lot of risk factors that can cause aneurysms, such as high blood pressure or hypertension, or you could have connective tissue disorders like Marfan syndrome. But there could be a variety of reasons why you can have it, but we can treat them all. Yeah.
And again, with the with the aneurysms, again, where the location of the aneurysm is important, because sometimes they present even like a heart attack, for example.
Oh, 100%. So ascending aortic aneurysms or dissections are called the great masquerader. So it could present as back pain, it could present as chest pain, it could present as dizziness. So it could present a lot of ways. Our emergency room is fantastic. They're very good about picking these things up, and we can get a CAT scan very quickly, and that really helps us settle everything out.
Yeah, it's like I tell the residents, the diagnosis you don't think about is one you're never going to make.
Exactly.
So at the medical center, we got that covered. So.
Correct.
Talk of the great masquerader, the last patient I had that had a dissection said he was having discomfort after doing a chest workout in the gym, and it turned out to be dissection.
It turned out to, that's exactly right.
But tell us more about, there's a lot of work you've brought, especially to Jersey City Medical Center, on mitral valve regurgitation and fixing. Tell us more about that.
Yeah, so the mitral valve is a valve that separates the main pumping chamber from the lungs. So when your lungs put oxygen into the blood, from the bad blood that you've used, they come through the mitral valve, which is right here, and it comes into the pumping chamber, and that pumps it to the rest of the body. When it squeezes, the mitral valve is supposed to prevent blood backing up into the lungs. And when it leaks, then you feel short of breath and your lungs get full. Historically, the way surgeons treated that was with replacement. But our goal is to repair most valves, so you can have your own natural valve and you can enjoy that for the rest of your life. Sometimes you do have to replace it, and we have a lot of options for that also. But our primary goal is to try to repair valves.
And again, I think that's very important to get that diagnosis early, and especially with these modern technologies, because again, in the old days, you had to replace the valve, which is a much larger recuperation.
Right.
It's a longer extent of disease because again, the timing, especially for example, for aortic valve replacement, was always at the fringe before you got them in, before heart failure, so to speak.
I'm so glad you brought that up. And that's the big advantage of a comprehensive heart center, is that these disease processes get picked up early. In the past, when we didn't have access to echo or to good health care, the diseases would present really sort of end stage and you were very symptomatic. Now we're able to pick it up before the patient has a symptom and really sort of almost predict when they're going to need something before they have any heart damage. So that's a really exciting thing about being at Jersey City.
And I think we can't say enough in our community that if you're having chest pain, discomfort, tiredness, I think you should go see a primary care doctor or cardiologist or emergency department, because we still see people come in late stages of disease.
Oh, I 100% agree with you. And the big thing to remember, it's not a bother. The worst case scenario is an extra trip to the emergency room, but at least you'll be safe, you know. So if you ever had a question and it needs to be answered, just go to the emergency room.
And let's talk real quick about heart failure also, because again, you have coronary artery disease, but you have devices that can assist, you have medications. Talk real briefly about heart failure and what we offer.
I'm so glad you brought that up. That's really close to my heart, pardon the pun. But you know, with the heart, three things can happen. You can have blockages of the vessels, you can have blockages or leakiness of the valves, or you can have dysfunction of the muscle itself. And so when the muscle does not squeeze well, you can go into heart failure. And historically, the only option for heart failure, when you're advanced heart failure, is transplant. Unfortunately, transplants are dependent upon someone donating their organ, unfortunately, you know. And the sort of organ pool has not changed, but the number of people needing one has really elevated or increased a lot, but the organ pool has not changed at all. So in other words, there's a lot of people who are dying waiting for organs. So what we're able to offer is something called a left ventricular assist device, which is a artificial heart or pump that we actually implant, and the patient is able to actually live a pretty full life with that. Just happen to have a model of one. So this is what an actual pump looks like. It's about this size. We actually put it in the heart just like this. And we're able to take over the function of the heart, and the patient's able to live, get out of heart failure and live a very good quality of life with that. And the big things on the horizon is that right now you actually have a power cord that comes out that we exteriorize and connect to batteries. Within the near horizon, about a year or two from now, everything will be fully implantable, so you won't even know that it's in there.
Well, we're going to definitely have to book you for another episode because this is just way too important and just so much information. It's incredible. Thank you so much for coming and joining us today.
My pleasure. Really enjoyed being here.
Thank you, Dr. Singh. We look forward to having you back on Hudson Health.
Thank you.
Thank you for watching Hudson Health, and we'll be back next time.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. And I'm here with my co-host, Dr. Akunyili.
Hello, everyone. I'm Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And we just had the extraordinary pleasure of interviewing Dr. Deepak Singh, new cardiothoracic surgeon, Chief of Cardiothoracic Surgery at Jersey City Medical Center. It was just so exciting. First of all, just listening to what a cardiothoracic surgeon does. We're both physicians. You're an internal medicine doc, I'm an ER doc. So we have a good idea, but I didn't think, a lot of people at home may not realize the scope of what a cardiothoracic surgeon does. Everything from the heart, the lungs, to solid cancers in the chest wall, and heart failure, and everything in between.
But again, even his passion and his demeanor, so soothing. I mean, so nice. Can you imagine you have to go to open heart surgery or something like that? I mean, I would want a doctor like Dr. Singh. Explains everything in detail, simple, simple for you to understand. I mean, it's just incredible.
It's that perfect marriage of the scientific rigor and expertise of medicine, the humanistic side, that it's such a potent combination when you find it in a physician, and Dr. Singh has that.
And it's kind of neat because he had his models, you know.
Yes.
And it's kind of funny because it does happen in my practice. You know, the patients really think that you cut out part of the artery and then you somehow put something else in. But the whole bypass thing is you're actually bypassing an obstruction. You go beyond and you reestablish flow, which is still the number one for morbidity mortality.
And depending on how many times you bypass, quadruple, triple bypass. So I thought he did a very good job explaining that. And he also talked about the aortic procedures, right, with his toys. Everything from the scary aortic dissection and aneurysm, which is a life-threatening emergency. The reason we tell people to go to emergency room if they have chest pain, to the TAVR procedure.
Yeah, especially with aneurysm, you know, because the proximal aneurysms, you and I know, especially you as an emergency medicine physician, what a nightmare that is. I mean, you know, you're basically diagnosing an acute heart attack in the presence of an aneurysm, because that's exactly what we see. The proximal ones, you know, dissect the left anterior descent, the left main coronary artery. Next thing you know, you got a heart attack in place. Huge, and you're really dealing with this dissection. I really liked how he basically broke it down for us, how all these specialties that are involved, how this is what they do, that these things typically do not get missed, you know, because a diagnosis you don't think about is one you're never going to make. And they think about everything, and they got just about all the bases covered.
Absolutely. I do think about it every time I see a patient in the emergency room with chest pain. But, you know, it's interesting. He talks to us. I was very fascinated by his talk about heart failure, right? Because certain types of heart failure, many, many years ago, if you did not get a transplant, were essentially a death sentence.
Yes.
But the technology has grown in leaps and bounds.
Yes. And again, Jersey City Medical Center offers the most comprehensive cardiac care in the county without a doubt. So it's just unbelievable. And on top of that, we have the academic practices.
I was going to say that, we, you know, just to be able to educate residents and fellows and the next generation of doctors, but to also be part of the greater RWJBarnabas Health facility, right? And not just have people like Dr. Singh, but to have expertise in our sister hospitals should a patient need a transfer for any other type of procedure.
And they specifically have a relationship at the medical center between the cardiothoracic surgeons and the TAVRs individual. Dr. Skelding and Dr. Singh actually work together prior. So it's like a family, you know, when you actually come.
They grew up in medicine together, were his words.
Yeah, so which is incredible. So. But I really like this, especially to talk about heart failure, you know, because that's one of the complications, you know, if you survive a heart attack, you know, you can end up with significant pump failure. So he kind of broke it down, explained how it was a disease of the muscle, whether it's due to an artery or whatnot. And again, the different treatments, because it's not just medications, it's like those devices, the LVAC device and so on and so forth. So it's very interesting to hear him actually talk about all this.
And then he emphasized the availability of that team to take care of our community. So if you think you're having a problem, what his words were, it's not a bother, please come in, we'll take care of you. And, you know, we don't need to go to New York City or go far away to get world-class care.
And it is a big deal, especially to get these valves replaced really early and so on and so forth. So we're definitely going to have to bring it back for another session.
I agree. I agree. Right. Well, it was a pleasure. Thank you for joining us again on another episode of Hudson Health.
Thank you, and we'll see you next time.
See you next time.